If you've noticed your feet and ankles swelling by the end of the day, especially after you turned 60, you're not imagining it. And here's what most people don't realize. That swelling might be your body's way of telling you something important. As a board-certified internal medicine physician, I've seen thousands of patients walk into my office concerned about this exact issue. But here's the good news. In the next few minutes, I'm going to show you exactly why this happens after 60. And more importantly, 3 things you can do tonight that actually work. One of them takes just 15 minutes before bed. Stay with me. Now, before I tell you about that 15-minute trick, you need to understand what's really happening inside your body when your feet swell. After age 60, your circulation system starts to change in 3 specific ways. And most doctors won't take the time to explain this to you. First, your veins become less efficient. Think of them like garden hoses that have been used for decades. They lose some of their elasticity. The valves inside your leg veins, which are supposed to push blood back up to your heart, start working less effectively. So fluid begins pooling in your lower legs and feet, especially when you're sitting or standing for long periods. Second, and this surprises most people, your kidneys don't filter fluids quite as efficiently as they used to. This doesn't mean you have kidney disease, it's just a natural part of aging. Your body holds on to a bit more salt and water than it did in your 40s. And third, this is the one most people miss. There's a change happening in your lymphatic system that almost nobody talks about. I'll explain exactly what that means in just a moment. Your lymphatic system is like your body's drainage network. It's responsible for moving excess fluid from your tissues back into your bloodstream. But after 60, this system slows down significantly. Here's what that looks like. Imagine a drainage ditch that used to clear water quickly after a rainstorm. Now it takes twice as long. That's essentially what's happening in your legs and feet. The good news? Unlike vein problems, which can be harder to fix, you can actually boost your lymphatic drainage starting tonight. But before I tell you how, you need to know the warning signs that mean your foot swelling needs medical attention right away. Because while most swelling is harmless, there are 3 red flags you cannot ignore. Listen carefully to these 3 warning signs. Red flag number 1, swelling in only one leg, especially if it's painful, warm to the touch, or red. This could indicate a blood clot, which is a medical emergency. Don't wait. Get checked immediately. Red flag number 2, swelling that comes with shortness of breath, chest discomfort, or rapid weight gain of more than 3 to 4 pounds in a day or 2. This could signal heart or kidney problems that need urgent evaluation. Red flag number 3, swelling accompanied by fever or skin that's shiny, tight, and painful. This might mean an infection that needs treatment. If you have any of these symptoms, put this video on pause and call your doctor. I'm serious about this. For everyone else whose swelling is just that annoying end-of-day puffiness, and you've been cleared by your doctor, let me tell you about those 3 things that actually help. The first one is so simple, but the timing matters. Solution number 1, elevate your legs. But here's the part most people get wrong. You need to elevate them above your heart level, and you need to do it for at least 15 minutes. Propping your feet on a coffee table doesn't cut it. That's barely elevation at all. Here's exactly what to do. Lie on your back and place 2 to 3 pillows under your calves and feet so your heels are higher than your hips. Do this for 15 to 20 minutes, ideally twice a day, once in the afternoon and once before bed. What's happening during those 15 minutes? You're literally using gravity to help drain that pooled fluid back toward your heart. It's like tipping a bucket to empty it. I tell my patients to do this while watching TV or reading. Make it a habit, and you'll notice a difference within 3 to 4 days. But elevation alone isn't enough for most people over 60. That's where solution number 2 comes in, and this one actually prevents the swelling from building up in the first place. Solution number 2. Graduated compression socks. And before you say, "Those are uncomfortable," hear me out. You're probably using the wrong kind. Not all compression socks are created equal. You want graduated compression socks, which means they're tighter at the ankle and gradually looser as they go up your calf. This design actually pushes fluid upward, mimicking what your veins should be doing naturally. Here's the level you need: 15 to 20 millimeters of mercury compression for mild swelling. That's moderate compression, not the medical grade 30 to 40 millimeters of mercury, unless your doctor specifically prescribes it. Put them on first thing in the morning before your feet start swelling. If you wait until your feet are already puffy, you've missed the window. And here's a tip most people don't know. Smooth them out carefully so there are no wrinkles or bunching. Any creases can actually make circulation worse. Now, compression helps during the day, but there's one more thing you can do at night that works while you sleep. This is the one that surprised my patients the most. Solution number 3 is actually 2 parts, and they work together. Part A, right before bed, do 20 ankle pumps. Sit on the edge of your bed and flex your feet up and down like you're pressing a gas pedal. Up, down, up, down. 20 times. This simple movement activates your calf muscles, which act like a pump to push fluid back up your legs. It takes 30 seconds and makes a real difference overnight. Part B. Stop drinking large amounts of fluid 2 to 3 hours before bed. I know this seems counterintuitive. You've probably heard you should drink more water for swelling. And during the day, yes, staying hydrated is important. But chugging water right before bed means your kidneys have to process all that fluid while you're lying flat, which can make morning swelling worse. Instead, front-load your hydration. Drink most of your water before 6 p.m. Your kidneys will thank you, and your feet will look better in the morning. Now, you might be wondering, what about water pills or diuretics? Shouldn't I just take those? Here's my medical advice on this. Don't start diuretics on your own. They seem like a quick fix, but they can throw off your electrolytes, your sodium, potassium, and magnesium levels. For people over 60, this can lead to dizziness, falls, or even heart rhythm problems. If your swelling is severe or not responding to these natural strategies after a week or 2, then yes, talk to your doctor about whether a mild diuretic makes sense. But for most people with typical end-of-day puffiness, the 3 solutions I just gave you will handle it. Give your body a chance to respond naturally first. So let's recap what we covered. Your feet swell after 60 because your veins, kidneys, and lymphatic system all slow down. That's normal, but you can manage it with 3 proven strategies. Elevate your legs above your heart for 15 minutes twice a day. Wear graduated compression socks from morning until evening, and do 20 ankle pumps before bed, while timing your hydration properly. Start with these tonight. Most of my patients notice less swelling within just a few days. And remember those red flags: one-sided swelling with pain, swelling with breathing problems, or swelling with fever. Those need immediate medical attention. You deserve to feel comfortable in your own body, and these simple changes can make a real difference. If this was helpful, I'd love to know in the comments. Are you going to try the ankle pumps tonight, or start with compression socks? Let me know. Take care of yourself and I'll see you in the next video.